everyone. Welcome to this video where I will be briefly talking about epidemiology. And I believe it's apt to say that epidemiology is in fact the backbone of public health. The word in itself is derived from a Greek word and can be broken down into epi, meaning on or upon, demos, meaning people, and logos, meaning the study of. So, in other words, the word epidemiology has its roots in the study of what befalls a population. Two of the very few easy ways to understand epidemiology is to grasp the concepts of distribution and causation. So, when I say distribution, I'm mainly talking about the way any particular disease or health status is spread in the population, globally, nationally, or even in your local community. So, we would want to understand the reach of this disease to devise different kinds of measures for the prevention and management of the disease in the community. The first aspect here that you would want to know is the demographics. So this would include understanding the population that is affected. So things like which gender is being affected more, what are their education levels, what socioeconomic group do they belong to, what kind of age distribution does it have? Is it mostly affecting the aging population or just the younger population? Do they have any health insurance or medical coverage? What's their occupation? And numerous different determinants like that. Another aspect is geography. So we'd want to know, where are these diseases actually prevalent? Is it in a specific country, a state, a county, or just in a local community? And this will definitely serve as a hint for us to reach the cause of this health issue. And the third aspect is temporality. So where we investigate the trends of any disease over a specific time period. We would want to know if there is any seasonality associated with the disease, how the incidence and prevalence of a disease is changing over time. When I talk about incidence and prevalence, I'm talking about the measures of disease, which are very important concepts in epidemiology. When I talk about distribution, I don't merely mean distribution of diseases, but also distribution of exposures. So exposures to things like natural calamities, for example, floods or hurricanes, any toxic materials in a nearby factory, different kinds of microorganisms, pollution, air pollution or water pollution, some other contaminants prevalent, or just mere access of vaccines and medicines for diseases can turn out to be crucial determinants of health. The another important concept is causation. So whenever we see any correlation between two variables, for example, X and Y, so if X increases with Y, we very quickly incorrectly assume that X is increasing because of Y, making an assumption that there is probably a causal relationship between X and Y. And these kind of inferences in public health are very common and are often influenced by things like bias, confounders, chance, and error. And these are some of the concepts which are covered in MPH epidemiology program here at James Lind Institute. Epidemiology is also used to search for determinants, which are the causes and what are the other factors that influence the occurrence of disease and many of the other health related events. So epidemiologists assume that illness does not occur randomly in a population, but it definitely happens only when the right accumulation of risk factors or determinants exist in an individual and the environment. So to search for these determinants, epidemiologists use analytical epidemiology or epidemiologic studies to provide the why and how of such events. So they assess whether groups with different rates of diseases differ in their demographic characteristics, genetic or immunologic makeup, their behaviors, environmental exposures, or other kinds of potential risk factors. So ideally, the findings provide sufficient evidence to direct prompt and effective public health control and preventive measures as well. So it's safe to say that epidemiology is not just the study of health in a population, but it also involves applying this knowledge gained by these studies to a community-based practice. So like the practice of medicine, the practice of epidemiology is both the science and an art. So to make the proper diagnosis and prescribe appropriate treatment for a patient, The clinician combines medical or scientific knowledge with experience, clinical judgment, and understanding of the patient. So similarly, the epidemiologist also uses the scientific methods of descriptive and analytical epidemiology, as well as the experience, epidemiologic judgment, and understanding of the local conditions in diagnosing the health of a community and also proposing appropriate, practical, and acceptable public health interventions to control and prevent disease in the community. So these are just few of the things that you will be learning in epidemiology, MPH epidemiology program. In addition to that, you'll also learn about the epidemiological approaches towards prevention of diseases, the different epidemiologic methods and statistical tools, strategies for disease surveillance and outbreak investigations, some of the advanced techniques in categorical data analysis, few of the essentials of biostatistics, and various such applications of epidemiology in disasters, infectious diseases, chronic diseases, and many more. Thank you.